This is NBC Connecticut News at 11.
So many of you have stayed away from doctors' offices and hospitals, but it's important to remember to keep up with your routine health needs, and it is safe to seek medical care. Joining us now, Dr. Andrew Lim, the Medical Director of Emergency Medicine at Bristol Health. Doctor, thanks for joining us this morning. We appreciate your time.
Well, thank you. Thanks for having me.
Doctor, what kind of impact did COVID-19 have on hospital emergency departments across our state earlier this year?
So initially when the stay-at-home orders were issued, we all expected that the lower acuity visits would really decrease. But what we found surprising was that the higher acuity visits or diagnoses of life-threatening illnesses did drop as well. So we saw really a decrease in the amount of heart attacks, strokes, and even sepsis, which is a blood infection, decreased significantly during the month of March. In fact, we saw about a 30 to 40% decrease between the first week and the last week in March of the rate of diagnoses. So, of course, one assumption could be, maybe these disease states got better or went away. But of course, we know that what's more likely is that a lot of these patients had a phobia of coming to the hospital. And unfortunately, we know that you're much more likely to die from a heart attack if you don't seek care than you are to die from COVID-19. So really the challenge has been, how do we get the message out there to our patient population that we've instituted a lot of significant protocols, safety protocols, to make sure that we can keep our patients safe to be able to seek appropriate medical care.
And as you get the word out, Doctor, have hospital emergency departments like yours begun to see an increase in patients of late?
So we have seen a little bit of an increase from March. In March, a lot of local emergency rooms saw about a 50% decrease in volume. At Bristol Health Emergency Room, we're not nearly at capacity. But for our patients, that's actually fantastic news, and I'll tell you why. In a traditional ER, you would check in, you would see registration, you would talk to triage, you would then be placed in a waiting room, and when your time was ready, you would be placed in a room to see the doctor. So when you count that out, that's about 4 different exposures. What we're doing right now is when you check into our emergency room, you're greeted by an ER technician. You'll be asked a series of screening questions. And regardless of whether you're at high risk for having COVID or whether you're at low risk for having COVID, we do our best to place you directly into a private room. So all of the other processes will come to you. Registration will come to you, the triage nurse will come to you, and of course the doctor will come to you as well. So what we're really trying to do is limit the amount of unnecessarily shuffling, because we know that that's really where those asymptomatic carriers can come into play, and that's where the risk of COVID will increase.
And Doctor, finally, I ask you kindly, because we're running out of time to answer this in about 20 seconds, more and more physician practices are using telemedicine. Bristol Hospital became the first hospital in the state to use telemedicine in its emergency department. How does that work?
Yeah, I'm glad you pointed it out. A lot of healthcare institutions utilize telehealth, but we've taken it a step further. So what we do is when a patient calls in and they seek medical advice, you can actually set up an on-demand visit with an ER physician like myself or one of my colleagues. We'll do an assessment over video chat, and if we determine that you need to come in, oftentimes you're ahead of the game already because you'll be seeing one of us, and likely the person that saw you over the video chat. If you don't need to be seen, we can give discharge instructions. You can even call in any necessary prescriptions. So the beauty of it all is that you're seeing a local doctor who probably knows your primary care physician, who knows the specialist. But also, if you do need to come into ED, we do waive that fee for the telehealth visit. So in essence, it's a free screening.
All right, Dr. Andrew Lim from Bristol Health, we appreciate your time. Stay safe.
All right, you as well. Thank you.
Thank you.